Welcome to Equine Euthanasia and End-of-Life Options, a veterinary roundtable presented by the Maryland Equine Transition Service, a program of the Maryland Horse Council Foundation. Please be sure to watch all 4 parts.
So greetings, my name is Dr. Kathleen Anderson and I'm an equine practitioner at the Fairhill Training Center in Elkton, Maryland. My assignment today is to provide a brief introduction to the METS Euthanasia Roundtable geared to providing facts and conversation about the subject of equine euthanasia. The Maryland Equine Transition Service, METS, is a statewide equine safety net initiative of the Maryland Horse Council that provides safe alternatives for horses in transition. Sometimes this includes the decision to humanely euthanize horses that have significant health or behavioral issues. The end of life is inevitable for all, man and beast, but it is not a subject that comes up very often for discussion, except under duress. The word euthanasia comes from the Greek 2 words, eu, meaning goodly or well, and thanatos, meaning death. So euthanasia is literally the good death. The following is a discussion by METS panelists on euthanasia of horses to bring transparency and informed decision-making to you, the horse owners. The METS panelists include equine practitioners, Drs. Justin Sobota, Peter Radu, Elizabeth Callahan, and small animal practitioner, Dr. Mary Gardner. The roundtable kicks off with a clinical discussion introduced by Dr. Sobota on the procedure or logistics of euthanasia, the science of euthanasia, if you will, which is comprised of a preliminary conversation for the horse's connections and the veterinarian. This is a critical preparation. When to say goodbye, before or after. Procedure options, to sedate or not, to anesthetize or not. What are the euthanasia methods available? What are the pros and cons? Safety is an imperative consideration for all, owners, handlers, and veterinarians. Location does matter to facilitate a safe ending for elective euthanasia. Options for disposal of body. METS lists resources, but this discussion also underscores the need for pre-planning in order to have a smooth transition. How to preserve memories. Dr. Callahan offers a keepsake kit to her clients with information on available options such as horsehair pots or lockets. The roundtable then shifts from the practical to the philosophic and personal. How do vets cope with the loss process? All veterinary panelists agreed with the premise that veterinary medicine provides a gift to relieve animal suffering no matter what the cause. The end goal is death with dignity. Grieving for horse owners is not commonly addressed. This will be unique to each person, but it is definitely a consideration to be aware of, and we hope that this conversation will open the door to asking for help if you are struggling with the grieving process. Dr. Gardner succinctly states that although we may not control the why or the cause of euthanasia, we can control the how, which underscores the need for this discussion and planning both the euthanasia and the grieving. Decision-making becomes the crux of the matter. When is it time? Education on quality of life scales will be specific to age and use of the horse, but primarily focused on eating, movement, drinking, and body condition or weight. Decision-making is personal. However, the panelists agree that there is often an underlying societal taboo on elective euthanasia, which can create angst for deciding, is it time now? Additionally, increased legal and moral obligations on abuse or chronic suffering cases are certainly forcing some much-needed accountability for all parties. Catastrophic cases are the easiest to move forwards with. A lack of rehoming options is likely maybe the most difficult scenario for those with a healthy but unwanted horse. For example, the aged healthy horse whose family is no longer able to care for it. Speakers point out how important it is to remember that euthanasia beats some other options, such as the unknown outcomes of the public sales ring or the serial adoptions. How to prepare emotionally for the finality of loss. It is okay to express emotions. It's good to be present if you are able. Death is a process. Horse ownership has seen a shift from livestock-based practice to a companion-based approach, and the METS panel discussion is invaluable to bridge the gap at the end-of-life transition for horses and their humans. I'm sure everyone will take home several useful thoughts to consider. So without further ado, please sit back and enjoy the conversation. Thank you.
Let's get right into it so that we make the most of our time. So we want to talk about equine euthanasia and what happens in a regular medical euthanasia. What are the medications used? What can owners expect when a vet comes to their farm to perform an equine euthanasia? Dr. Sobota.
Super. Good morning. I wanted to start just with the fact that there are AAEP guidelines for euthanasia. I think that's a first step that we need to talk about quickly in order to understand some of the general aspects of euthanasia when it comes to horses. Certainly, there are a handful. One would be a lethal dose of a barbiturate. Second is gunshot to the brain. Third is a penetrating captive bolt. Fourth would be a lidocaine, 2% intrathecal, which can be done under surgical plan of anesthesia. And then you can also use a concentrated potassium chloride or a mag sulfate IV, also under surgical plan of anesthesia. So those are more common ways or acceptable ways by AAP that we should all have a certain groundwork and an understanding of. Certainly there are other alternatives in special circumstances that as a veterinarian we may need to implore, but those are the general guidelines for euthanasia according to AAP. Now, a lethal dose of pentobarbital sodium, a barbiturate, is typically the form of euthanasia that we provide as veterinarians. With or without sedation sometimes is up to the veterinarian, of course, in my opinion, in the sense of maybe the anxiety of the animal. And so if there is a level of anxiety that we feel that we need to provide some sedation, we'll do that. And then certainly we may or may not actually then put in a catheter. We'll put a little local anesthetic in the jugular vein and then put a catheter in depending on the anxiety of the animal as well, and then perform the overdose of barbiturate, the pentobarbital sodium. So those are some things to consider. I know some people think about a general plan of anesthesia even before the pentobarbital, and I think that's something that we could always discuss and think about and talk about. But that's a general idea of how euthanasia is completed out in the field or at the clinic. And I know we had some really good questions that were provided, and we're just trying to go down some of the groundwork here. In general, euthanasia for horses is fairly speedy. It can take several minutes, as it is an overdose of medication that initially stops the heart, really. Sometimes, in my opinion, the discussion and the explanation of euthanasia with the owner, and of course getting to that point, is what takes the most amount of time. And so we need to understand that and have a good bedside manner and trying to have our client or the patient owner, etc., companion owner, understand these things. And so for me, it takes a lot more time for explanation and certainly to be a part of the process, which is a very valuable process. And so that takes more time. But in general, right, the actual aspect of euthanasia doesn't take a ton of time. After the euthanasia, of course, we're always going to check for heart rate. We're always going to check for corneal reflex. And these are important things that we want to think about as well when we're euthanizing horse before we step away as veterinarians. another good question I saw, and just to try to bring some general basis to what we're doing here this morning, there was a question about reactions of providing a barbiturate. And so, yeah, there are certain reactions or a timeline of euthanasia, if you will, during those several minutes. I think one of the biggest things that we think about when euthanizing is, as a veterinarian, keeping everyone safe, right? And so sometimes it is hard to control a large animal from going left or right or backwards, and sometimes it may be difficult to do that. And I think people have to be somewhat prepared for that. It's certainly not a non-dramatic, right? It can be somewhat dramatic experience, even though you may do everything correctly and try to create the best environment and situation for the owner and the horse. It can be somewhat dramatic, and so we always have to be aware of that.
Is there a pro or con to using or not using a sedative before the barbiturate dose?
Well, in my experience, and certainly I'd like to hear from Dr. Adu as well, and certainly if there's an anxiety level of the horse, right? If this horse is quite anxious, then yes, I'll typically provide sedation to try to lower the heart rate a little bit, get that under control, because if you're injecting a large amount of barbiturate, I want to make sure I do it correctly. And so I'll sometimes want to sedate them just a little bit, but that can, there's some cons to that as well. If you over sedate them, certainly it can take potentially a longer time for that barbiturate to get into the system, and may take a little longer for the actual euthanasia process to happen. So there's that thought as well.
One of the biggest downside I've seen is with neurologic horses that are being euthanized, that giving them a sedative will cause them to decompensate and often be much more unsteady on their feet.
I agree with Dr. Radu. I think that it endangers the handlers and the veterinarian if you have a horse that's already unsteady in its feet and you tranquilize it. It can be quite dangerous to try and work around that horse.
Yeah, you mentioned controlling a 1,000-pound horse. Sometimes I've had experience with difficulty in controlling a distraught owner. And having them want to hug the horse goodbye before it's gone, or before it goes down, and putting themselves in substantial risk. So I try to be clear about rules about letting me take lead shank when the drug has been administered, and taking 10 big steps backwards.
Yeah, Dr. Gill, I think that's a really good point. I will typically have maybe an assistant with me, and I may have my assistant sometimes handle the horse in that situation, because I certainly don't want fingers to get caught in lead shank, as you're suggesting, or the halter, et cetera. And having that assistant, they know what I'm doing sometimes rather than the owner themselves sometimes. I think that can be safer for the situation sometimes. So I like your point there.
And I agree with you. I always take the lead shank if I don't have an assistant, because I don't want someone losing a finger or a hand during that period of time, and they certainly can. Plus, a lot of people don't realize how quickly the horses go down, and if the horses go down forward, they'll trample the person in front of them. So I'm always the one to take the lead shank as well.
I think that's a really good point. I think that that's maybe something that many people don't understand, because we want to be there for our horses in those final moments, but you know, we have to keep the humans as safe as possible. So I think that's a really interesting, good point to bring up that maybe a lot of people aren't aware of. As you mentioned at the beginning, Dr. Sobota, there are other methods approved by the AAEP. In this region, medical barbiturate euthanasia is more preferred. I think in other parts of the country, gunshot euthanasia might be the more go-to method. Any insight as to why that is the case? Why is gunshot euthanasia not as accepted here, do you think? Is it based solely on the impact that it can have on the humans. You know, hearing a gunshot, I think, is a little bit more traumatic than watching an injection. Do you think that has anything to do with it, or do you think it's a more medical basis?
I think it's a demographic basis, that this is just a different demographic than we're going to see ranching people, people that have cattle, people that have treat the animals more as livestock. I think it's a much more acceptable reason. I just think that this is just a different demographic than other areas of the country, and you know, that's what's preferred here. I'm not sure how the other doctors feel, but
Yeah, I have never actually done one, but I believe a gunshot properly done is equally humane.
You're right. I think certainly demographics are a big part of it. Certainly much more accepted in the West and the ranching community where horses are considered livestock. Legally they're considered livestock, but certainly emotionally they may be more considered livestock in a different ranching environment than, say, here in Maryland.
So we had a number of questions about alternative medical ways. I mean, the most commonly used is the barbiturates, but there's been a lot more chatter recently about composting those animals and burying those animals, and the effects that it has on the environment and scavenging animals if the horse wasn't buried deep enough and they were to dig it up. Dr. Radu, you've used alternative methods before,
I've done a total of 2 horses with potassium salts, and it went quite well. It's there was a little bit of involuntary movement as it was being given. I have no qualms about the humaneness of it. It's noticeably more time-consuming to get organized to do it. It's dissolving. I worked it out to be the typical container of light salt in a 5-liter bag of fluids, and getting that dissolved and ready to go. You know, if you have an urgent euthanasia with a fracture or something like that, it's awfully easy to just fall back on what's you've done many times in the past successfully.
I have used the intrathecal lidocaine, and I felt after general anesthesia, and I felt it went very well. I did feel a little bit more involuntary movement. It took a little bit longer for the heart to stop. I am sure the animal was completely anesthetized, and I felt it was very humane and certainly a practical alternative as far as volume and preparation. Most of us have lidocaine on our trucks, and also methods to put an animal under a short-term general anesthetic. So I felt my issue would be, again, with a neurological horse that I'm trying to introduce anesthesia with, it certainly could be a little bit problematic, but I felt it worked very well.
Dr. Mary Gardner, this is Justin. What other forms of euthanasia do you guys provide in the small animal?
This has been very interesting, and I've been dying to ask some questions. But like you, most of ours is with barbiturate, and it's really mostly the route that we give it. And every pet that I euthanize, I fully anesthetize them, and that way they're laying down, they're sleeping. The owners can snuggle up on them and love on them. I kind of actually, when I lecture to veterinarians, I say, for those of you that don't want to sedate, again, totally okay. Nothing wrong with that. And in the UK, the majority actually don't sedate first in small animal. But I say without it kind of reminds me of an equine euthanasia, where it's very sudden and the pet is standing maybe and they just, collapse. And I remember that in vet school, that sudden death of a pet or of a horse, and it just startled me a little bit. And I think for owners, it could startle them where, if it's their house cat and dog that is, sleeping in their bed, and it's their family member to have that. And so I think it provides a really nice gradient of within the process. So it's sleeping. Oftentimes they'll say, wow, this is the most, best sleep that they've seen them have. They've been anxious also, they've been painful. And so to see that is really nice for the owners. And then that allows me to go any route I want. So it's really the route for us. And everyone's go-to is a saphenous vein, let's say. Usually in clinics, they all want indwelling catheters. I go to homes and I just do a butterfly catheter. And of course, our dosing is way smaller and than a horse. But if I need to, and very often I do just by default, I'll go intrahepatic because it's nice. I just give it. It takes about 10 minutes or so for the pet to pass, and I can step back and let them still be with their pet without, you know, this abrupt passing. But a lot of times their vessels are challenging, and their, you know, legs are all edematous and their abdomens are swollen, and so I'm very much comfortable and very prepared to do intrahepatic, intrarenal, and cats all day long. I remember speaking with some equine vets, and they're like, oh, intrarenal, because these barn cats, you guys, it was hard for them to find a vein in a barn cat. So, so I'm like, oh, try the intrarenal method. You'll never want to do anything else. And even intracardiac, it's just how you explain it. It's what's most important. And so that's the majority. And, you know, it is interesting in the different demographics, even in the pet space. Here in South Florida, gunshot would never be considered. I also lived in Oregon for a year, and every one of the farmers thought what I did was insane. They're like, we just shoot our dogs. I don't understand this. So it's use, it's connection, it's whatever. But I think all small animal veterinarians should be ready and equipped to do all the routes, because it's not always easy to get a vein, and we have to be adaptable. And now my question to you guys is there a way though to sedate and like anesthetize a horse so they are lying down safely before you give the second medication? Or is that not possible? Not normally possible?
So, Dr. Gardner, to your point, when I euthanize a horse, I always talk to those. I'm in mixed animal practice, so I also work on dogs and cats. So I will tell them this is not going to be like your dog and cat, that the horse is going to fall. It's not going to be as peaceful or as pleasant as, you know, your dog or cat euthanasia, simply because of the size of the horse. And to answer your question, yes, we can anesthetize them. They still fall down, and they still fall down hard. So it's not like they just gently bend their knees and lie down. I mean, they fall the same way, whether you anesthetize them or not. So you still have that sudden, you know, and I think that's the hardest thing for the owners, is that sudden from standing to down with, you know, and sometimes these horses are in poor shape. They'll fracture their pelvis or something going down, and no, they don't feel it, but you can hear it, you know. And I think sometimes it's very difficult for owners. And I always warn them that it is not going to be like their dog or cat that they've had put to sleep.
Yeah, no, I give you guys much credit, because it is a much more physically and emotionally challenging euthanasia, I think.
My standard line to people is that once they start to collapse, they're already unconscious, and if they hit the ground hard, they don't feel it.
Thank you for watching. Please be sure to watch the other installments of this roundtable. Also, please consider donating to keep METS a part of Maryland's equine community. Let us know if you'd like to see a roundtable about any other subjects. Thank you very much and have a great day.